Question 1. In the context of healthcare, which of the following is a key challenge when adopting cloud computing solutions for healthcare organizations? A. Cloud computing enables the storage of unlimited patient data without any limitations. B. Cloud computing often leads to increased patient engagement through mobile apps and portals. C. Security concerns related to patient data privacy and compliance with regulations like HIPAA are significant challenges. D. Cloud computing solutions are generally inexpensive and have no long-term financial impact. Answer. C. Security concerns related to patient data privacy and compliance with regulations like HIPAA are significant challenges. Explanation. The adoption of cloud computing in healthcare presents various challenges, particularly related to data security and privacy. Healthcare organizations must comply with strict regulations like HIPAA, Health Insurance Portability and Accountability Act, to ensure patient data remains confidential. Secure. The nature of cloud environments, which store data off-site, raises concerns about unauthorized access, breaches, and non-compliance with regulatory standards. Furthermore, while cloud services provide flexibility and scalability, they also introduce complexities in managing data security protocols, encryption, and secure data transmission. Therefore, addressing security risks and ensuring HIPAA compliance are critical when adopting cloud solutions in healthcare. Options A and B are incorrect as they oversimplify the advantages of cloud computing, and D is incorrect as cloud solutions typically involve significant financial planning and investments. Question 2. Mr. Anderson is tasked with managing a health project aimed at implementing an electronic health record (EHR) system in a medium-sized healthcare organization. The project team is using the Agile methodology for this implementation. During the planning phase, it becomes clear that the project's scope has expanded beyond initial estimates. What is the best course of action for Mr. Anderson? A. Immediately halt the project and review the budget to assess if it's still feasible to continue. B. Ignore the scope creep and continue with the project, focusing on delivering the EHR system as quickly as possible. C. Adjust the project scope, document the changes, and communicate the impact on timelines and resources to stakeholders. D. Change the project methodology to waterfall to ensure that the scope is fully defined and executed according to plan. Answer. C. Adjust the project scope, document the changes, and communicate the impact on timelines and resources to stakeholders. Explanation. In project management, particularly within health, scope creep is a common issue. The Agile methodology, which is iterative and flexible, allows for adjustments to the project scope. In this scenario, Mr. Anderson should adjust the scope and document any changes, ensuring that the impact, timelines, resources, and budget is communicated clearly to all relevant stakeholders. By doing this, he can manage expectations and ensure that the project stays on track, even if the scope has expanded. Option A may prematurely halt the project without considering the impact of scope changes. B ignores the need for proper scope management. And D is inappropriate because switching to waterfall would conflict with Agile principles of flexibility and iterative delivery. Question 3. Which of the following is a critical factor when selecting a vendor for a healthcare system, specifically an electronic health record (EHR) system, and ensures compliance with regulatory standards such as HIPAA? A. The vendor's ability to provide the cheapest solution regardless of other factors. B. The vendor's ability to offer customizable solution tailored to the specific needs of the healthcare organization. C. The vendor's lack of history in healthcare implementations, as this ensures fresh perspectives and new ideas. D. The vendor's ability to quickly implement the system with minimal consideration of regulatory compliance. Answer. B. The vendor's ability to offer customizable solution tailored to the specific needs of the healthcare organization. Explanation. When selecting vendor for an EHR system, it is critical to choose provider that can offer solution that is not only cost-effective but also customizable to meet the specific needs of the healthcare organization. Tailored solution ensures that the system integrates smoothly with existing workflows and complies with regulatory standards. Like HIPAA, compliance with HIPAA is paramount for protecting patient data, and customizable EHR system helps ensure this by accommodating the organization's unique security and privacy requirements. Option focuses too heavily on cost without considering customization or regulatory compliance, while C overlooks the vendor's experience in the healthcare field, which is essential for regulatory adherence. Option D disregards the need for regulatory compliance, which is non-negotiable in healthcare projects. Question 4. In a healthcare organization, Mr. Thompson is overseeing the implementation of a new clinical information system, CIS. The system is designed to improve clinical workflows, enhance decision-making, and ensure accurate patient records. However, during the early phases of the implementation, staff members are expressing concerns about the usability of the system, particularly in terms of navigating the system and integrating it into their clinical routines. How should Mr. Thompson approach these concerns to ensure the system's successful adoption while maintaining clinical efficiency? A. Mr. Thompson should abandon the CIS implementation and focus on other methods of improving clinical workflows, as the system is not user-friendly. B. Mr. Thompson should encourage staff to adopt the system regardless of their concerns, as it is a requirement from management. C. Mr. Thompson should focus on providing comprehensive training sessions and offer ongoing support for staff members, addressing usability issues and customizing the system based on feedback. D. Mr. Thompson should temporarily halt the project until all usability concerns are resolved, even if it causes delays, to ensure the system is perfect before implementation. Answer: C. Mr. Thompson should focus on providing comprehensive training sessions and offer ongoing support for staff members, addressing usability issues and customizing the system based on feedback. Explanation: the adoption of new clinical information systems, CIS, can face resistance due to usability issues. The most effective way to ensure the system's success is by offering continuous support and training. In this case, Mr. Thompson should listen to the concerns of clinical staff and provide tailored training sessions that address specific usability issues. Feedback should be collected from the staff, and the system should be adjusted and customized based on their input. This process helps to ensure that the system integrates smoothly into clinical workflows while maintaining user satisfaction. Option is incorrect because abandoning the project would undermine the potential benefits of the CIS. Option B is too rigid and ignores the importance of addressing user concerns, while D suggests an unnecessary delay, which could hinder the organization's progress. Question 5. Which of the following strategies is most effective in ensuring data security and privacy when implementing a health information exchange high system in a large healthcare organization? A. Implementing minimal encryption and using basic authentication methods for system access to avoid complexity. B. Focusing on broad access for all staff members to ensure timely patient data retrieval regardless of role-specific access restrictions. C. Implementing strong encryption, multi-factor authentication, and ensuring compliance with HIPAA and other relevant privacy laws to protect patient data. D. Using paper-based backup systems, all electronic records, to ensure data security in case of a system breach. Answer: C. Implementing strong encryption, multi-factor authentication, and ensuring compliance with HIPAA and other relevant privacy laws to protect patient data. Explanation: when implementing a health information exchange, high system security and privacy are paramount due to the sensitive nature of patient data. To comply with HIPAA and other privacy laws, healthcare organizations must ensure that robust data protection measures are in place. It includes using strong encryption to protect data during transmission, implementing multi-factor authentication to secure access to the system, and ensuring that only authorized individuals can access specific patient data. Compliance with HIPAA regulations ensures that healthcare organizations meet legal requirements for protecting patient confidentiality. Option is inadequate because minimal encryption and basic authentication methods do not provide sufficient security. Option B is problematic because broad access to patient data increases the risk of unauthorized access, violating privacy laws. Option D, using paper-based systems as a backup, is inefficient and outdated in a modern healthcare environment. Question 6. Mrs. Jackson is a project manager in charge of selecting a new electronic health record system for a hospital. The hospital is looking for a system that integrates well with existing clinical and administrative systems while also improving the efficiency of patient care. What is the most critical factor to consider during the vendor selection process to ensure the best fit for the hospital's needs? A. The vendor's ability to provide the cheapest solution available regardless of the system's functionality or features. B. The vendor's ability to demonstrate deep understanding of healthcare workflows and regulatory requirements such as HIPAA. C. The vendor's focus on offering the most advanced technology even if it doesn't align with the hospital's existing infrastructure. D. The vendor's ability to provide solution with minimal customization to implementation time. Answer: B. The vendor's ability to demonstrate deep understanding of healthcare workflows and regulatory requirements such as HIPAA. Explanation. When selecting an AIS system, the most important factor is how well the system aligns with the healthcare organization's existing workflows and regulatory compliance needs. Healthcare organizations must ensure that the selected vendor understands both the clinical and administrative aspects of the institution, provide an AIS system that fits seamlessly into daily operations. Additionally, compliance with HIPAA and other healthcare regulations is essential to protect patient privacy and ensure legal compliance. Option is incorrect because cost should not be the only consideration when selecting an AIS system. Functionality and regulatory compliance are far more important. Option C is incorrect because advanced technology might not always be suitable if it doesn't integrate with the current infrastructure or meet the hospital's specific needs. Option D overlooks the importance of customization, which is often necessary to tailor the system to the unique needs of the hospital. Question 7. Which of the following is the most appropriate method for managing and safeguarding clinical data when transitioning from paper-based records to electronic health records? In a healthcare organization. A. Scanning and digitizing all paper-based records without verifying the quality and accuracy of the data before inputting it into the AIS system. B. Using a hybrid system that keeps both paper records and AIS while gradually transitioning to an all-digital system over time. C. Immediately discarding paper records once they are scanned into the AIS system to save storage space even if the digital records are not fully verified. D. Encrypt digital records, conducting regular audits and ensuring proper data validation procedures are followed before transitioning to AIS. Answer. D. Encrypting digital records, conducting regular audits, and ensuring proper data validation procedures are followed before transitioning to AIS. Explanation. When transitioning from paper-based records to electronic health records, data quality, security, and compliance are critical. It is essential to encrypt digital records to protect patient data during transmission and storage. Regular audits should be conducted to ensure the integrity of the data being transferred from paper to digital formats. Additionally, proper data validation procedures are necessary to prevent errors or omissions in the digital records. Option is incorrect because scanning without verifying the quality of data may lead to inaccurate or incomplete records. Option B, while potentially useful for a gradual transition, doesn't emphasize the importance of data validation and security. Option C is incorrect because discarding paper records before validating the digital version could result in the loss of important information. Question 8. In the context of healthcare, which of the following best describes the role of clinical decision support systems, CSS, in improving patient safety? A. CSS are primarily used for financial management and budgeting in healthcare organizations. BCSS can alert healthcare providers about potential medication errors, allergies, and adverse drug interactions, thus improving patient safety. C. CSS are used to generate clinical research reports, but they do not play a role in day-to-day patient care. E. CSS can replace clinical staff by making all treatment decisions for patients, ensuring consistent care. Answer. BCSS can alert healthcare providers about potential medication errors, allergies, and adverse drug interactions, thus improving patient safety. Explanation. Clinical decision support systems, CSS, are designed to assist healthcare providers by offering evidence-based recommendations and alerts that can help prevent errors, improve patient safety, and enhance the quality of care. One of the key roles of CSS is to alert clinicians to medication errors, allergies, and adverse drug interactions, which significantly reduce the risk of harm to patients. Option is incorrect because CSS are not used for financial management. Option C is incorrect because CSS are directly involved in patient care and do not merely generate clinical research reports. Option D is incorrect as CSS are designed to assist healthcare providers, not replace them, and clinical staff must still make final treatment decisions. Question 9. When implementing a health system in a healthcare organization, which of the following is an important consideration for ensuring long-term success and user adoption of the system? A. Selecting a system that has the lowest upfront cost even if it lacks long-term support and features. B. Focusing solely on technical performance and ignoring user feedback or training needs. C. Ensuring the system is designed with user-friendly interfaces, provides adequate training, and supports ongoing user feedback to improve the system post-implementation. D. Immediately pushing the system live without sufficient testing or pilot runs to time and minimize delays. Answer. C. Ensuring the system is designed with user-friendly interfaces, provides adequate training, and supports ongoing user feedback to improve the system post-implementation. Explanation. Long-term success and user adoption of a healthy system depend on several factors, including system usability, user training, and continuous improvement, ensuring that the system has an intuitive user interface, providing comprehensive training for users and establishing mechanisms for ongoing feedback can help improve user engagement and facilitate smooth adoption. Ongoing support and feedback are essential to address any usability issues or workflow bottlenecks. Option is incorrect because costs should not come at the expense of system quality and long-term usability. Option B is flawed as ignoring user feedback and training needs can lead to poor adoption and dissatisfaction with the system. Option D is risky because insufficient testing and pilot runs can lead to significant operational disruptions and errors. Question 10. A large hospital is implementing an advanced patient management system (PMS) to streamline patient scheduling, admissions, and discharge processes. However, after the initial rollout, staff feedback indicates that the system is not user-friendly and leads to delays in patient processing. Which of the following actions would most likely improve the system's adoption and efficiency? A. Increase the system's complexity to ensure all possible scenarios are covered in the software, even if it means steeper learning curve for the users. B. Limit the system's functionalities to just patient scheduling, ignoring other hospital needs to make it easier for staff to use. C. Offer targeted training sessions. Customize the system to suit the hospital's specific workflows and continuously gather user feedback to address concerns and functionality. D. Provide users with basic training and allow them to figure out the system independently over time, assuming they will eventually adapt. Answer. C. Offer targeted training sessions. Customize the system to suit the hospital's specific workflows and continuously gather user feedback to address concerns and optimize functionality. Explanation. The key to improving adoption and efficiency lies in understanding the hospital's specific workflows and addressing any gaps or difficulties identified by the staff. Offering targeted training helps ensure that staff members are well prepared to use the system effectively. Continuously gathering feedback allows for adjustments to the system that improve usability and performance. Option increases complexity unnecessarily, while B limits the system's potential to improve hospital-wide processes. Option D lacks the proactive support necessary to ensure successful adoption. Question 11. In the context of a health information exchange high, which of the following strategies is most effective for ensuring that sensitive patient data is shared securely among different healthcare providers? A. Sharing patient data without encryption to expedite information exchange, assuming that all participating providers have adequate security protocols. B. Implementing end-to-end encryption, ensuring that patient data is protected during transmission and access is restricted to authorized personnel only. C. Allowing healthcare providers to access patient data freely without any restrictions to promote collaboration and decision-making. D. Encourage patients to directly manage their health data and share it with providers as needed, bypassing the need for centralized data systems. Answer. B. Implementing end-to-end encryption, ensuring that patient data is protected during transmission and access is restricted to authorized personnel only. Explanation. End-to-end encryption ensures that sensitive patient data is kept secure during transmission and can only be accessed by authorized healthcare providers. This is the most effective way to maintain the confidentiality and integrity of patient information in a health information exchange. Option is not secure enough as it does not protect the data during transmission. Option C allows too much freedom and creates potential vulnerabilities for unauthorized access. Option D bypasses essential security and privacy protocols, undermining the whole purpose of a secure exchange system. Question 12. Dr. Williams is a physician working in a hospital where the electronic health record (EHR) system has recently been upgraded to a newer version. Despite the improvements in functionality, Dr. Williams finds the new system to be time-consuming and confusing compared to the old one. What should the hospital administration do to help Dr. Williams adapt to the new system? A. Revert to the old EHR system immediately to avoid any disruptions in the doctor's workflow. B. Offer targeted and ongoing training sessions to help Dr. Williams understand the new system's features and optimize his workflow. C. Allow Dr. Williams to use the old system while others transition to the new one without providing any support. D. Assume that the doctor will eventually get used to the system and discontinue any further training or support? Answer: B. Offer targeted and ongoing training sessions to help Dr. Williams understand the new system's features and optimize his workflow. Explanation: when new system is implemented, it's critical to provide comprehensive training to help users adapt to changes. Offering targeted and ongoing training helps individuals like Dr. Williams understand the system's new features and how they can be used to improve their workflow. Option is short-term fix and doesn't address the long-term benefits of the new system. Option C is not an ideal solution because it isolates Dr. Williams from the rest of the team and doesn't promote proper adoption of the new system. Option D ignores the need for continuous support and feedback to ensure the doctor can use the system effectively. Question 13. A healthcare organization is implementing a new telemedicine platform to provide remote consultations. During the pilot phase, patients report that they face connectivity issues and some clinicians struggle with using the platform's interface. What should the organization prioritize to ensure successful deployment of the telemedicine platform? A. Immediately expand the platform's capabilities, adding more features before resolving the technical issues. B. Focus on enhancing the platform's technical stability by improving internet connectivity, streamlining the interface, and providing staff with adequate training. C. Limit access to the telemedicine platform to a small group of patients and clinicians without seeking feedback from them on their experiences. D. Discontinue the use of the platform altogether and revert to in-person consultations as the primary mode of healthcare delivery. Answer: B. Focus on enhancing the platform's technical stability by improving internet connectivity, streamlining the interface, and providing staff with adequate training. Explanation: the successful implementation of telemedicine platform requires addressing both technical and user experience issues. Improving internet connectivity and the platform's interface, along with offering training to both clinicians and patients, is crucial to ensure smooth usage. Option focuses on adding unnecessary features before resolving critical technical issues. Option C limits the feedback needed to improve the platform. Option D is premature and disregards the potential benefits of telemedicine in improving access to care. Question 14. Which of the following is a key challenge when transitioning from a traditional paper-based medical records system to an electronic health record system in a rural healthcare setting? A. A lack of internet connectivity that hinders data access and communication. B. Overabundance of technical infrastructure that requires significant resources to manage. C. Insufficient regulation and standardization of air systems across rural regions. D. A complete absence of any healthcare professionals who can operate the system. Answer A. A lack of internet connectivity that hinders data access and communication. Explanation: in rural healthcare settings, internet connectivity can be a significant barrier to implementing an effective electronic health record system. Lack of reliable internet access makes it difficult to access and update patient records in real time, which undermines the effectiveness of the air system. Option B is not usually a challenge in rural settings, as the issue often lies in the lack of infrastructure, not an excess of it. Option C may be a concern in some areas, but is not as critical as connectivity. Option D is unlikely, as rural healthcare organizations generally have staff capable of operating air systems. Question 15. Which of the following actions is most effective in ensuring that a newly implemented electronic prescription (ERCS) system is compliant with the Drug Enforcement Administration (D) regulations? A. Allowing healthcare providers to manually enter controlled substance prescriptions, bypassing the ERCS system for faster processing. B. Integrating the ERCS system with a secure authentication process that complies with D regulations and restricts unauthorized access. C. Allowing patients to access and modify their own prescription data to streamline the prescription process. D. Encouraging providers to use paper prescriptions for controlled substances and only use ERCS for non-controlled medications. Answer: B. Integrating the ERCS system with a secure authentication process that complies with D regulations and restricts unauthorized access. Explanation: to ensure compliance with D regulations, ERCS systems must have strong security measures in place, including secure authentication and encryption for controlled substance prescriptions. This ensures that prescriptions are not altered or accessed by unauthorized individuals. Option is not compliant with regulations, as it bypasses the ERCS system. Option C introduces security risks and could violate privacy and regulatory guidelines. Option D is not A sufficient solution, as the ERC system should handle all prescriptions, including those for controlled substances. Question 16. During a healthcare organization's cybersecurity training program, staff member mistakenly clicks on phishing link compromising sensitive patient data. What should the organization do immediately to mitigate the potential impact of this breach? A. Ignore the breach and assume that no harm has been done, as the staff member only clicked link. B. Immediately notify the department, implement system-wide lockdown to prevent further compromise, and investigate the breach to assess the full impact. C. Advise the staff member to delete their email account and move on without reporting the incident to higher authorities. D. Inform patients directly about the breach, but do not involve it. Security teams, as the staff member has already taken corrective action. Answer. B. Immediately notify the IT department, implement a system-wide lockdown to prevent further compromise, and investigate the breach to assess the full impact. Explanation. In the event of a cybersecurity breach, immediate action is essential to minimize potential damage. Notifying the IT department, locking down affected systems, and investigating the scope of the breach will help contain and mitigate the impact. Option is negligent, as even minor breaches can have significant consequences. Option C is incorrect because the incident must be reported and addressed by it and security teams, not handled individually. Option D is not ideal as it involves skipping necessary steps like informing it and properly assessing the breach. Question 17. A hospital is adopting a new clinical decision support system CSS to assist doctors in making more informed decisions based on patient data. However, after several months, some physicians report that they feel the alerts from the system are overwhelming, leading to alert fatigue. What is the most effective solution to reduce this fatigue while maintaining the effectiveness of the system? A. Disable all alerts to ensure that physicians can focus on their clinical decision-making without distractions. B. Prioritize and fine-tune alerts based on the severity of potential issues and ensure the system is customizable to each physician's preferences. C. Increase the frequency of alerts to ensure that physicians are fully aware of any potential risks at all times. D. Remove the decision support system entirely and rely on traditional practices without technological assistance. Answer. B. Prioritize and fine-tune alerts based on the severity of potential issues and ensure the system is customizable to each physician's preferences. Explanation. Alert fatigue is a known issue with clinical decision support systems, CSS, and it can occur when clinicians receive too many non-urgent alerts, which leads to desensitization. The solution is to fine-tune the system to prioritize important alerts, ensuring that only high-priority notifications are delivered and allowing physicians to customize alert settings. Option A removes the value of the CSS system entirely. Option C increases the likelihood of alert fatigue by overwhelming clinicians with unnecessary information. Option D disregards the benefits of the CSS in improving decision-making and patient safety. Question 18. What is the most critical aspect of ensuring patient privacy when implementing a cloud-based health data storage solution for a hospital? A. Ensuring that the cloud provider has sufficient physical security protocols in place at its data centers. B. Limiting access to the cloud storage system to only administrative staff to ensure minimal exposure of patient data. C. Implementing strong encryption for both data in transit and data at rest, along with robust access controls and regular audits. D. Relying solely on the cloud provider to handle all security measures and involving hospital its staff in the process. Answer. C. Implementing strong encryption for both data in transit and data at rest, along with robust access controls and regular audits. Explanation. When implementing a cloud-based storage solution, ensuring patient privacy requires strong encryption measures to protect data during transmission and while stored in the cloud. Additionally, robust access controls prevent unauthorized access, and regular audits help monitor and identify security vulnerabilities. Option addresses physical security but is insufficient on its own. Option B restricts access too much and could hamper operational efficiency. Option D is risky because hospital its staff should play an active role in ensuring the security of patient data. Question 19. A healthcare organization is planning to adopt a new electronic health record system. One of the major concerns is the potential disruption to daily operations during the transition phase. What is the most effective strategy to minimize the impact of this transition on patient care and staff productivity? A. Implement the new system without any prior notice, expecting staff to adapt quickly to the new system. Beat use. A phased implementation approach where the new system is gradually integrated, allowing staff to adjust and provide feedback at each stage. C. Replace the old system entirely with the newer system on the first day, without providing any support or training to staff. D. Limit the system's features to basic functionalities and delaying the integration of more advanced features until the staff becomes comfortable. Answer: B. Use a phased implementation approach where the new system is gradually integrated, allowing staff to adjust and provide feedback at each stage. Explanation: a phased implementation approach minimizes the risk of disruption by allowing staff to adapt to the system gradually. This allows for adjustments based on feedback from users, ensuring a smoother transition. Option A is disruptive and assumes staff can instantly adapt, which is unrealistic. Option C lacks any support and would lead to significant operational challenges. Option D delays important functionalities and reduces the overall benefits of the system. Question 20. A health insurance provider has implemented a predictive analytics tool to assess the risk of patients developing chronic conditions. The tool uses historical data to forecast future healthcare needs and identify high-risk patients. What is the primary ethical concern associated with using such a tool? A. The tool may exclude certain high-risk populations based on outdated data, leading to unequal care opportunities. B. The predictive analytics tool will provide the insurance provider with the ability to raise premiums for high-risk patients. C. The tool may encourage providers to disregard the preferences of patients in favor of algorithm-driven decision-making. D. The tool may result in a decrease in healthcare costs for patients, eliminating unnecessary treatments. Answer A. The tool may exclude certain high-risk populations based on outdated data, leading to unequal care opportunities. Explanation: a primary ethical concern in using predictive analytics tools is the potential for algorithmic bias, where the tool may unfairly exclude high-risk populations based on outdated or incomplete data, leading to disparities in care. Option B is a concern related to insurance pricing but not directly related to the ethical use of predictive tools. Option C is a concern but the main issue is related to potential bias and unfair treatment. Option D, while related to costs, does not address the ethical dilemma in terms of patient care equity. Question 21. During the rollout of a new mobile health application for patient engagement, several patients express concerns about the security of their personal health information. What steps should the healthcare organization take to address these concerns? A. Assure patients that their information is secure, but make no further changes to the app's security features. B. Conduct a security audit to ensure the app meets all relevant compliance and privacy regulations and clearly communicate the results to patients. C. Discontinue the app altogether to avoid any further concerns, even if the app provides valuable services to patients. D. Reduce the app's functionality to the bare minimum to eliminate any potential security issues, even if it limits its benefits. Answer: B. Conduct a security audit to ensure the app meets all relevant compliance and privacy regulations and clearly communicate the results to patients. Explanation: conducting a security audit ensures that the app meets all privacy regulations, such as HIPAA in the US, and enhances its security features. Transparency with patients about these findings helps build trust. Option: it does not address the root cause of the concerns, while option C overreacts by discontinuing a potentially valuable service. Option D reduces the app's utility unnecessarily, which could negatively impact patient engagement. Question 22. A healthcare provider wants to integrate a new telemedicine platform into its existing system, but there are concerns about patient data privacy and compliance with the Health Insurance Portability and Accountability Act (HIPAA). What is the best approach to ensure compliance and protect patient data during telemedicine consultations? A. Rely on the telemedicine platform provider to ensure HIPAA compliance and assume the platform's security measures are sufficient. B. Implement end-to-end encryption. Ensure the platform provider signs business associate agreement and train staff on data privacy requirements. C. Allow patients to access telemedicine services without any encryption, assuming the platform is safe because it is widely used. D. Use paper-based record. Complement telemedicine consultations, reducing the amount of digital information being shared. Answer: B. Implement end-to-end encryption. Ensure the platform provider signs a business associate agreement and train staff on data privacy requirements. Explanation. To ensure HIPAA compliance, the provider should implement encryption for data security, ensure the platform provider signs above a requirement under HIPAA, and train staff on data privacy and security protocols. Option assumes too much reliance on the platform provider without sufficient verification. Option C disregards encryption, which is a fundamental privacy safeguard. Option D introduces inefficiencies and does not fully protect the privacy of digital consultations. Question 23. A healthcare organization has decided to switch from an on-premise infrastructure to a cloud-based system for storing and managing patient data. What is the most important factor to consider during this transition to ensure patient data security? A. Ensuring that the cloud provider offers sufficient scalability to meet the organization's future growth needs. B. Verifying that the cloud provider implements strong encryption, compliance with industry standards, and access controls to safeguard patient data. C. Focusing only on cost reduction, as cloud solutions tend to be cheaper than on-premise infrastructure. D. Implementing cloud-based storage without modifying existing access policies. Ensure that all staff can easily access patient data. Answer. B. Verifying that the cloud provider implements strong encryption, compliance with industry standards, and access controls to safeguard patient data. Explanation. The primary concern when transitioning to a cloud-based system is ensuring that patient data remains secure. Verifying encryption, compliance with industry standards like HIPAA, and robust access controls ensures that the data is protected. Option is important but secondary to security concerns. Option C may lead to cost-cutting that compromises security. Option D disregards the necessity of controlling access to patient data, which is critical for privacy. Question 24. A hospital is implementing an advanced analytics tool to predict patient admissions and optimize staffing levels. Which of the following is the most significant challenge when integrating this tool into the hospital's existing information systems? A. Ensuring the predictive tool can access real-time patient data without compromising data integrity. B. Reducing the predictive tool's complexity so the hospital staff can easily use it without training. C. Limiting the tool's functionality to only predict general patient volume without focusing on individual patient needs. D. Implementing a tool that can only be accessed by administrators, not clinicians, to prevent misuse. Answer A. Ensuring the predictive tool can access real-time patient data without compromising data integrity. Explanation. The primary challenge is ensuring that the predictive tool can securely access real-time data from the hospital's existing systems while maintaining data integrity. This is crucial for accurate predictions and effective staffing. Option B underestimates the need for proper training on complex systems. Option C limits the potential utility of the tool. Option D unnecessarily restricts the tool's accessibility, which reduces its overall effectiveness in improving hospital operations. Question 25. A healthcare organization wants to implement a comprehensive patient portal that allows patients to access their health records, schedule appointments, and communicate with their healthcare providers. What is the most important consideration to ensure the portal's successful adoption by patients? A. Ensure the portal is available in multiple languages to accommodate diverse patient populations. B. Prioritize creating a user-friendly interface that makes it easy for patients to navigate and complete tasks independently. C. Limit the portal's functionalities to just viewing health records, assuming this is all that patients need. D. Require patients to opt into the portal and not provide additional support to those who are hesitant. Answer. B. Prioritize creating a user-friendly interface that makes it easy for patients to navigate and complete tasks independently. Explanation. A user-friendly interface is essential for encouraging patients to use the portal effectively. It reduces frustration and increases patient engagement with the platform. Option is important but secondary to ease of use. Option C limits the portal's potential, reducing its overall value. Option D could alienate patients who need help and may prevent successful adoption of the portal. Question 26. A healthcare organization is considering the implementation of a patient-centered care model. What technology solution would most effectively support this model and improve communication among healthcare providers and patients? A. Implementing a secure communication platform that allows providers to discuss patient cases, share documents, and consult with specialists in real time. B. Installing a robust billing system that ensures patients are aware of their financial responsibilities and can pay for services online. C. Adopting A cloud-based data storage solution to centralize patient records without providing access to the care team. D. Encouraging patient schedule appointments online without offering any further tools for communication with their care team. Answer A. Implementing a secure communication platform that allows providers to discuss patient cases, share documents, and consult with specialists in real time. Explanation. A secure communication platform enables effective collaboration among healthcare providers and improves communication with patients, which is a key element of patient-centered care. Option B is related to billing, not communication or care coordination. Option C centralizes records but doesn't address real-time collaboration and patient interaction. Option D lacks the necessary tools for comprehensive communication between patients and providers. Question 27. During a system upgrade, a healthcare organization experiences difficulty integrating patient data from multiple legacy systems into a new electronic health record (EHR) system. What is the most effective strategy to ensure a successful data migration? A. Migrate data all at once and assume any issues will be resolved after the system goes live. B. Conduct a phased migration, testing each dataset for accuracy and compatibility before proceeding to the next. C. Skip data migration entirely and rely on manual data entry for new patient records moving forward. D. Delay migration indefinitely until a perfect solution for all integration issues is found. Answer B. Conduct a phased migration, testing each dataset for accuracy and compatibility before proceeding to the next. Explanation. A phased migration allows for more manageable and less disruptive integration, with the opportunity to address any issues as they arise. This approach reduces the risk of data corruption or loss. Option is risky because it doesn't allow for proper troubleshooting. Option C delays progress and increases the risk of data inconsistency. Option D is impractical and may delay the benefits of the new system. Question 28. A healthcare system is looking to improve its data analytics capabilities in order to enhance patient outcomes. Which of the following is the most important data-related consideration for ensuring that the analytics solution produces meaningful results? A. Ensuring that the analytics tool is able to process large volumes of data quickly. B. Ensuring that the data being analyzed is accurate, complete, and representative of the patient population and healthcare conditions being studied. C. Ensuring that the analytics solution is only used for billing purposes to reduce administrative costs. D. Ensuring that the solution uses the most advanced machine learning algorithms available. Answer B. Ensuring that the data being analyzed is accurate, complete, and representative of the patient population and healthcare conditions being studied. Explanation. For meaningful and reliable results, the data being analyzed must be accurate, complete, and representative of the population and conditions being studied. This ensures the outcomes are valid and actionable. Option addresses speed, but without the quality of data, speed alone is not useful. Option C focuses on billing rather than patient outcomes. Option D focuses on advanced technology, but without solid data, even advanced algorithms may not produce effective results. Question 29. A healthcare provider is considering implementing a machine learning model to predict patient remissions within 30 days of discharge. What is the primary challenge in using such a model effectively in a real-world setting? A. Ensuring that the model can be deployed without requiring significant resources from the healthcare staff. B. Ensuring that the model is transparent and interpretable to clinicians so that they can trust its recommendations and integrate them into their decision-making. C. Ensuring that the model always provides correct predictions to avoid any false positives or negatives. D. Ensuring that the model can operate without continuous updates to algorithms, assuming it will remain accurate over time. Answer B. Ensuring that the model is transparent and interpretable to clinicians so that they can trust its recommendations and integrate them into their decision-making. Explanation. Transparency and interpretability are crucial in healthcare, as clinicians must understand the rationale behind a model's predictions in order to trust and act on them. Option is important for deployment but doesn't address the real challenge of trust and clinical integration. Option C is unrealistic, as no model is perfect and will inevitably have some false positives or negatives. Option D assumes that model can operate without updates, which is impractical given changing healthcare conditions and patient populations. Question 30. A hospital is looking to integrate a patient management system with its billing system to streamline operations and reduce errors. What is the most significant challenge in integrating these two systems? A. Ensuring that both systems use the same database platform for data storage and access. B. Ensuring that the integration respects patient confidentiality and adheres to HIPAA regulations. C. Ensuring that the billing system can process transactions quickly regardless of the complexity of the patient management system. D. Ensuring that staff are trained to use the integrated systems effectively, minimizing disruptions to hospital operations. Answer: B. Ensuring that the integration respects patient confidentiality and adheres to HIPAA regulations. Explanation: ensuring that the integration complies with HIPAA and protects patient confidentiality is the most critical aspect of integrating patient management and billing systems. This ensures that sensitive data is protected during the exchange between the systems. Option is important but secondary to compliance and security. Option C is a performance concern but does not address the core issue of privacy and legal compliance. Option D is important but cannot be prioritized over compliance with confidentiality regulations.